So the next, hello friends. Now I would like to discuss about the next drug, which is the fourth drug in pediatrics, which is called as adrenaline. Okay, so in the adrenaline, what is the preparation of adrenaline? Preparation is 1 ml ampule, which is seen in 1 in 1000 solution. Okay, the dose of this adrenaline, if you see, it is seen in 0.01 cc per kg per dose of 1 in 1000 solution. If the solution is 1 in 1000, then the dose is 0.01 cc per kg per dose. Now, what is the uses? Uses can be divided as neonates and older children. So what are the uses of adrenaline in neonates? In neonates, adrenaline is used in resuscitation. Okay. It is used in infant of diabetic mellitus mother, and adrenaline is used in cardiac arrest. And also in hypoglycemia. Then in older children, if you see, it is used in cardiac arrest, anaphylaxis. Adrenaline, it is used in bronchial asthma or hypoglycemia. It is used in hemostasis. As hemostasis, it is used in epistaxis. Okay, so these are the different uses of adrenaline. Now, what are the side effects of adrenaline? Side effects of adrenaline are pallor, palpitations, arrhythmias. Okay, so these are the side effects of adrenaline. So thank you guys for watching my lecture. All these side effect uses are from Chedda book of practical book of pediatrics. So thank you for watching my lecture. Thank you.